Hello, hi, my name is Gambrell. I'm a nurse practitioner student at California Baptist University, and I'm just going to go over a patient presentation of a patient that I've treated in clinical. So, patient is a 30-year-old married Hispanic female. She was diagnosed with, in the past, with anxiety and panic disorder. And the patient reports that she had a major adverse drug reaction when she took Wegovy, and she had to go to the ER. She felt like she was having a heart attack. She had palpitations and everything. She was sweating. She felt like she was going into shock. Um, and they gave her a dose of Ativan, and it seemed to go away. About a week later, the panic attack came back. And she again had to go to the ER, and they gave her Ativan, and went away. At that time, it was recommended for her to go to an IOP, or intensive outpatient treatment program. And so she started that, completed it, was doing well. They put her on a little hydroxyzine and propanolol. She didn't seem to tolerate it well, and so she stopped that. Um, However, she felt like she couldn't relax. Um, and she reported having some burning in her arms and discomfort in her organs, like her stomach was upset, she said. Um, and uh, and that's why she stopped those medications. Um, for the past 6 months, she reported that she felt wired at times, that she couldn't relax. The patient said that it was hard for her to concentrate, so she had to drop out of college. It was hard for her to focus. She couldn't sit through a lecture. Um, and one of her primary care doctors prescribed her Wellbutrin, and what else was that? Wellbutrin and Lexapro, and it didn't work. She just stopped taking it, she said. She also has a history of Hashimoto's thyroid disease, so she's on levothyroxine to help manage that. Um, she also reports that she can't sleep at night. She wakes up in the middle of the night and just lays there ruminating on. She reports that she also has some financial difficulties. Her and her husband are having some trouble making ends meet, so she keeps her up late at night. She also feels like she has a vibration in her body. She said, like in her arms and legs sometimes, and she doesn't really know what the cause is, so that kind of worries her. And yeah, so that's pretty much where she's at in a nutshell. She doesn't really take much psych meds, except for she does PRN alprazolam. I believe that was, let me see the amount, 0.5 milligrams, one tab PRN for anxiety, and she's taking Seroquel, 100 milligrams, or quetiapine, 100 milligrams, one tab Q8 every night. And she's still having really bad anxiety. So, some of the symptoms that she's having, the difficulty concentrating, so she dropped out of college, problem staying asleep, easily fatigued. Those are symptoms of GAD, and you need at least 3 according to the DSM. She also had some abdominal distress, chest pain, palpitations, lightheaded episodes where she would actually faint, and paresthesias, like the numbness and tingling. And those are symptoms of panic disorder, according to the DSM, and you need at least 4 of those. And she meets the criteria for that. She does not have any allergies. She doesn't smoke, she doesn't drink, doesn't use any other drugs, no cannabis, but she does drink 3 cups of coffee per day. So that's probably contributing. No surgical history. She has 2 children that were born via cesarean section, has the Hashimoto's thyroid disease. No inpatient psychiatric hospitalizations, but she has gone to the ER at least 3 times for panic. Also attended the intensive outpatient treatment program, and she also had panic attacks that led to fainting. So that's her psychiatric history. No childhood illnesses. Let's see. Her mother had a history of anxiety, but never sought treatment. Review of systems. Patient denies any pain or discomfort. No fever, but just feeling uneasy and anxious on that visit. Objective GAD-7 was 20. The PHQ-9 was 8. So we were trying to rule out depression with the PHQ-9, but the GAD-7 was 20, so she definitely has some anxiety. Her vital signs were normal. Let's see, she had a mild to moderate weight challenge. She was sitting upright. Her foot was fidgeting with her leg crossed. So she was definitely anxious. She had some poor eye contact. She was dressed appropriately and well-groomed. Alert and oriented. Very worried on her mental status exam. Poor insight to her problem. Her speech was a little overproductive. It was hard to get some words in. Management plan. We're going to start lorazepam, 0.5 milligrams BID to control anxiety and panic. And we're going to keep it controlled, keep it scheduled. For the, we're going to start sertraline, 25 milligrams PO daily. And for the first week, it will increase to 50 milligrams daily if tolerated for the second week. We're going to stop the alprazolam so we don't have 2 benzodiazepines, because that would not be good. We would continue this to quetiapine, 100 milligrams, 1 tab at night. Follow up in 2 weeks to see if the medications are effective. I would encourage journal writing to discover what's going on in her life. So that way she can try to find some insight to her problems. I would encourage her to start psychotherapy to assist with managing stress and anxiety. We discussed also reducing caffeine intake and try to stop it if possible, because I think that was a major contributor. In the future, we may start buspirone if the sertraline is ineffective. And the buspirone would be 7.5 milligrams PO/BID if the sertraline alone is ineffective, or the sertraline with the quetiapine. Education. Oh, definitely. We did a brief psychotherapy session on learning how to deep breathe and manage, acute stressful situations. The patient was able to perform these deep breathing exercises during the session, and she said it was effective. So she said she would use that if she felt stressed. Also, with sleep hygiene, we encouraged her to have no electronics and no television, at least an hour before bed or longer if she can. And we encourage reading before bed. That might help her, sleep better. Let's see. Also, encourage the patient to get some self-help books to manage anxiety. That's usually a pretty good strategy. It gives people a different perspective on how to manage their anxiety symptoms. Also, in the anticipatory guidance, we let her know that sertraline can cause some dizziness, drowsiness, nausea, headache, and fatigue, and usually that'll go away in time. And it takes about 4 to 6 weeks to get full effect from the medication. And we also emphasize staying on course with the treatment plan, because it may, if you don't take the medication as prescribed, it can't work. So, and most of the side effects will go away with time. And with the vibrations, like Dr. Duke, the doctor I was working with, was thinking that she could have some absence seizures, possibly. And if it continues, then we would consult neurology and to rule out any suspected seizure activity. But specifically, CBT techniques primarily, would be a good thing for her. So that way she can kind of figure out, what's happening in her life, how she can control and manage her anxiety and stress. And I think that's it. Thank you very much.